My name is Dr. Alok Roy. I'm chairman of Medica Group of Hospitals. We are Eastern-based healthcare group, and our main hospital is in Kolkata, Ranchi, Odisha, Bihar, Jharkhand, Assam. Though West Bengal has not joined Ayushman Bharat, but West Bengal healthcare indices are reasonably good, and there has been a lot of work in healthcare in West Bengal, and West Bengal has got a parallel to Ayushman Bharat known as Swasthya Sathi, which is not as widely implemented as Ayushman Bharat is because of not non-central joining hands. Otherwise, Swasthya Sathi is good. It gives good benefit, useful to the hospital. A lot of patients have been benefited by that. Bengal healthcare challenges are because as compared to the rest of the country, we have less number of hospitals, and especially providing tertiary and quaternary care. So as a result, patients are still going out of Bengal. They are going to south, they are going to west, they are going to north. So as now there is a renewed focus and into east and Bengal, hopefully that in the next 5-10 years it will improve and become better. Medica Journey, we are 9 years old, and Medica Journey has been very fulfilling. We realized that there is a existence of gap as compared to the rest of the country, especially south and west, which are far more developed in healthcare wise. So we focused as a first generation of entrepreneurs in building healthcare in Calcutta and Eastern India. Today we are the largest chain. We have got 14 hospitals across Eastern India in all major states. And I think we have left our mark. And today we are the biggest brand in Eastern India, and which is very fulfilling. It was the need of the hour. As a nuclear cardiologist, a nuclear medicine specialist, to this point, I don't think my journey is, I have done much in my journey. But yes, we have built multiple hospitals across Eastern India, and it has been very satisfying because every patient who steps into our door, through our door, we get one more opportunity in serving him. So we feel that we have been able to create various hospitals which are able to serve more and more those who can't serve themselves. That in itself is a huge, very satisfying indeed, and we are happy to create more such facilities. We are alleviating pain. We are cutting down on suffering, human sufferings. So in a way, we all are doing what everybody else is doing. The how we differentiate us, we feel that for us it's more of a service. We help people in helping themselves when they need most. Those who come to us are the ones who don't want to come to us. Nobody comes to a hospital because he is happy. He comes to the hospital that because he is forced to. Somebody's father is dying, somebody's child is dying, somebody's wife is dying, somebody's son is dying. So in such varied circumstances, for us to be able to help them is what crosses our mind first. Our first role is to ensure that whoever comes, we give them whatever best we can. We restore them to normal health which each individual is entitled to. That, I think, in my understanding, is biggest differentiator between us and other healthcare chain. Yes, that's a journey which is the toughest part of the journey so far, that how to make the modern healthcare affordable. We are unsupported by the government or unsupported by any means. That means we have to earn from the patients and treat them, and still make enough money to sustain the system and give good quality services which every individual, every human being is entitled to. In today's world, in Indian scenario, it's a very tough call. So, but we are working hard, and there's hardly any profit in healthcare ventures like this. You don't make tons of money. It's basically a valuation game. It is not a game of being highly profitable. So within our limited profit, we are able to hold on to the quality and hold on to our expansions, and we are able to expand, give good quality care, and emerge as number one. Talks a lot about how frugal we are in our expenditures, how careful we are in our dealing with patients and how careful we are in giving them assurances which we are able to fulfill. We want to continue marching, we want to continue developing such facilities in underserved part of the country. That's how we are in Eastern India, which everybody knows is the much underserved as compared to the north, west or south. So in this underserved market, we want to create more such footprint which are center of excellence like all Medica hospitals, and we want to give comfort with the quality and a cost which people can afford. When we decided to expand our chain beyond Bengal, we chose state capitals. We chose Ranchi, we chose Patna, and because they were the nearest state, Jharkhand and Bihar, and we went there with super specialty. In Patna, we went for a heart hospital, which is one of the biggest and largest supported heart hospital in Patna, by the name of Magad Heart Hospital, in Medica Magad Heart Hospital in Patna, which does all kinds of cardiac treatment, interventions, angioplasties, angiographies, bypass surgeries, valve replacements. And similarly in Ranchi, we picked up a hospital which became the super specialty hospital. It has got a neuro center, it has got a cardiac center, it has got a gastro center, it has got a huge nephro center. We brought those tertiary and quaternary care to Jharkhand. Now, just to give an example, that around a month back on 28th May, there was a bomb blast where 26 CRPF Jawan were picked up 150 kilometers away from Ranchi, and they were brought straight to Medica Hospital, and out of them 15 had eye injury and multiple amputations. But the government thought that we are right candidate for those CRPF injured Jawans to be brought in. Is a huge support or a huge mindset for that place. So that's how whenever we go and expand, we build up a center of excellence around super specialty care, because secondary care has always existed in those areas, but super specialty cares are missing. Similarly, we have done in Odisha, in Kalinganagar, which is 100 kilometers from Bhubaneswar. We have a cancer hospital in Rangapani, which is near Siliguri. So we have always built super specialty care at a cost which people can afford.